This site currently administers something like several hundred doses a day. The expectation is to go into the thousands. How likely is that?
6,000.
That sounds
like quite a lot. It sounds like a lot. You know, when we started at State Farm, our objective was to start slowly, go with 800 a day. And I think by the end of the first week, we were up to 4,500 a day. We're averaging about 9,200 a day right now. And if we had a larger volume of vaccine available, we could get to 12,000 a day. This site is built out to do 6,000 a day, every day, if we're running it 24 hours.
There are no guardsmen here today, but there will be soon. What sort of role will they be filling when they are here?
So typically at a site, we will work with the incident manager, in this case, the University of Arizona. And if they have gaps in either data entry, any logistics support, or traffic control, we can fill them with really any soldier or airman. If they have gaps in the need to either monitor folks post-vaccination or give vaccinations, just about 200 of our guardsmen that are on orders right now that have medical specialties, they are also qualified to administer vaccine and do those types of things.
Okay. There is some concern that there are not enough to go around. We could run out. How do you manage that as the guy who's in charge?
Well, we continue to work with the Department of Defense on the logistics side and with Dr. Christ on the health side to make sure that we're ordering proper amounts. As you know, there was some really rough weather this week around the country, so there was a delay in shipment. I have gotten assurance from my logistics folks and from all the folks on Dr. Christ's team that the Pfizer vaccine, we have ample supply until our next shipment is in. I'm not confident right now where we're at with Moderna. We're going to make it at least through tomorrow, but there may be some interruption with the Moderna based on the missed shipment. But as soon as we get it back in, we'll get it up and running.
Okay. This week, President Biden said by July, everybody who wants a vaccine should be able to get one. Can you ballpark it here in the state? So
I've been saying that our objective is to have 3.5 million, which is about half of our state, vaccinated by July 1st. Right now, at our current production schedule, our biggest challenge is going to be getting out to the rural and tribal communities to keep them on pace, which is why most of the uniformed guardsmen I'm going to put out in the more austere and rural conditions. You won't see them much in Maricopa or Pima County because the communities have such a depth of resources to get things done. And I'm confident that we'll make 3.5 million citizens or let 3.5 million have access to the vaccine by then, and if demand exceeds that, we'll continue it through the end of September. Again, it's an all drive-through site, but they have multiple lanes and multiple vaccine sites set up, 5 cars deep, 3 wide, so up to 15 cars at a time.
What else is happening behind the scenes that the average person may not realize?
So I think the biggest thing that is probably misunderstood about the Guard is that we are very small. 7,600 people is not that many. But what we do is we bring a depth of knowledge for logistics planning and sustainment. So like at this site, we helped expand Pima County's already great footprint here to expand the hours.
Has it been a heavy lift to have to shift course?
It has been something we train for all the time. You know, we never know if it's going to be a pandemic or an earthquake or a wildland fire or whatever. Those types of missions still have the logistical backbone that needs to be supported, the sustainment, the feeding, the water, all the things that we train to do militarily when we put 13,000 of our brothers and sisters in arms on the other side of the ocean.
Could you do it for the next year if you had to?
We right now are on orders through the end of this fiscal year, through 30 September, and then the federal government will make a decision about extension of the mission and the progress of the response to COVID-19. And if they stand it down, I'm certain our community will be ready to fill in.
You have decades of service in the Air Force, and I know you say that you plan and you prepare and you train for this. But stateside, did you ever anticipate this sort of mission?
I never imagined, you know, you talk about how we declare emergencies at the state level. I never had a vision of all 50 states declaring a statewide emergency at the exact same moment. And kind of in this position, what we've had to do as we've tackled COVID is kind of fight with what we've got in our local communities and in the Guard. And I just couldn't be prouder of how all Arizona communities have stepped up and answered the call.
All right, Major General McGuire, thank you.
Thank you, Lorraine.